Hi, everyone. Welcome back to A Tribe Called Dhillon podcast. I'm Angie Dhillon.
And I'm Rose Dhillon.
And I'm Alvin Dhillon.
And we are back to part 2 of our conversation with Dr. Inderjit Dadiala, aka Dr. D. And we're discussing all things oral health and getting to know Dr. D so that we can inspire you to take better care of your teeth. And that's it, right? Dr. D, take better care of your teeth. That is the name of the game, right?
Yes.
Why do you think people don't take care of their teeth?
I think things have changed quite a bit. Now I find the smile has become a big attraction with all the looks. The smile is like if you have a person with one tooth missing versus to having a beautiful face, then, people, you see the smile more. And there is actually a picture where one person is missing an eyebrow and it's missing a tooth, and everybody noticed the missing tooth versus to missing eyebrow.
Wow, interesting.
So then that's why I find that now people are a little bit more conscious about their smile. Only the financial aspect is when people kind of starts not taking care of their teeth.
That makes sense then. Yeah. Now, Dr. D, I want to get into, before we start getting back into the dynamics of teeth and how to take care of ourselves, we want to get to know you on a personal level because your story is so inspiring. We know that, how long has Rainbow Dental Center been in business for now?
We've been in business for like 35 years.
Wow. So you're obviously a pioneer, as I mentioned in the first episode, a pioneer in the field of dentistry here in the Lower Mainland. What made you decide to go into dentistry as a profession?
So it's a funny story. When I was little, I used to always love those titles in front of people's names. And in India, everybody had S so-and-so, which means Sardar so-and-so. And all the men had titles, but women had no titles on them. So I said, okay, I want to have a DR in front of my name. That was the inspiration. But then when my dad had a friend who was an elder, and he was a doctor, and we used to visit him quite often. And he had a beautiful garden of 100 variety of roses. And we often went for a walk in his beautiful garden. And that's where he honestly did have 100 variety of roses. And he had a mulberry tree. That's where I first time saw a jackfruit tree. So, it was like fascinating. So he passed away not too long later, but he was a big inspiration too. And then dentistry, an opportunity came to get into dentistry, which I could not refuse. And I took upon, when I came to Canada, I found out this was a better choice for me because it really helped me with my family life, and I could have work-life balance. I didn't have to get up in the middle of the night and go look after emergencies or maternity. And also, I didn't have a village to raise my kids. So dentistry gave me that flexibility.
Dr. D, so 35 years ago is when Rainbow Dental Center opened up. But prior to that, there's always, as you mentioned, all this prep work that you did before getting into the field of dentistry. But how did you know and challenge the status quo at that time? I'm assuming, I'm doing the math now right now. If 35 years, Rainbow Dental, let's say prior to that, at least 10 years of education, that's 45. So 45 years ago, the landscape for women was so different. So how did you convince your parents at that time saying, no, I'm not going to just be a housewife and bred children, nothing wrong with that, or bear children, I should say, not bred children, but can you imagine breeding children? But how did you challenge the status quo and all those naysayers to say, no, this is a female, she shouldn't even be dreaming?
Right.
What made you dream so big?
Again, it's my dad. He was 4 years old when he lost his mother, and he didn't get any opportunities of going to school. And also that was his big passion, to watch his kids grow and go into education. So I was never given any hindrance. It was my brothers and me all had same opportunities, but I was able to go into school. I went to convent school. I had my English. So when I came to Canada and had to write my exams, it was not a problem for me because I know a lot of people that came from different parts of the world. It was so difficult for them to write multiple answers because they had to first translate the questions to their language and then answer it. And then the questions are so close to each other that you miss what the meaning of that question was.
When it translates.
When it translated. So I didn't have that issue. My family was very supportive, and that helped me go forth in my career.
Was there ever a time that you're like, I can't do this? Like, there's no way, it's just too much?
No, I've always had a hunger for education. I still have that. I think the day when I don't have the passion and hunger, I think I'm going to retire then. But so far, I'm in a lot of study clubs, and I really enjoy doing what I do. I honestly do.
And I know that because you're also an educator. You are at the Faculty of Dentistry at the University of British Columbia. You teach there as well. Is that correct?
I am at part of faculty. I haven't gone back after COVID, but yes, it is quite a privilege. And the reason was a little bit selfish on my part, because I have been practicing dentistry for so long that I wanted to find out, have I gone away far from my basics? That was my take when I went to teach the students, to see where I stand, because I wanted to be still what they are learning. Do I am the same way, or have I just sidetracked a lot? And I was happy that I was in the ballpark. So that made me really happy.
No, I think it's great too, because like I was saying when we had Dr. Shiv on, I think the key for any doctor to be successful is to continuous learning, right? Because things change, especially with technology now coming out. Yes. I think it's really great that you're still at that place where you're like, I've got the passion and I want to continue learning, because then things change and you're not left behind.
Right.
Yeah.
Yes. And since I graduated, I've been, first I went into this endo study club, which I was part of it for over 11 years. So I do a lot of endo, which means root canal treatment. Okay. And that really helped me. It was a very good group. What we would do is we would bring a patient. First, we'll have a little lecture. Then we work on a patient, and then we will criticize each other's work. So half of us will be working and half of us will be criticizing. So then we'll alternating, because you want just to better yourself. So then afterwards we will sit and after the treatment is done, we have our x-rays and we'll sit and discuss what was done and how it went. So, and that keeps you afloat, when you're doing something, you're not your skills, because dentistry is all about skills and your handwork and your illusion to bring the smile, the symmetry of face, all those things. It's all an artistry to do somebody's.
I'm so glad you said that, because I heard that for the very first time on a podcast. And I mean, I don't feel like there's enough dentists on podcasts that talk about stuff, but one of them was saying that he looked at it as art. And I'd never thought dentistry and artists, like that was something that I would never have put that to. And then you had said it earlier. So I think that's really great. Maybe you can elaborate on like the artist aspect of being a dentist.
So recently there was a young student that was shadowing me, and he said to me, I have to get my hand-eye coordination good. And he had some pictures that he was trying to color. And that was his hand-eye coordination. He had to do looking in the mirror and doing it in the reverse fashion. And I think this is what they were asking students to practice on. And then I started thinking. And then as a young person, I found my mother. She was a very talented lady. She would do embroidery and she would do sewing. And also for me, it was mandatory that every summer vacation, you had to do something. You cannot just sit home. You had to get a trade, either do knitting or do sewing or go do food preservation class, jam making, baking. So I had to, every summer holidays, we did something. And then the embroidery, that part came about really very handy later in dentistry, because, when I was doing suturing, because surgery is my passion. And then I was suturing, and every time I would go, thank you, Mom. You could put
wow.
So, all those things kind of
help you. Yeah. That's amazing.
Can I ask you, Dr. D, I don't know what a root canal is. I've, knock on wood, never had a root canal. Have either of you?
Yeah, I have had
Okay,
one.
can you explain what a root canal
and
is?
And thank you. You don't want to have root canal.
Yeah, it's
because that means you are good at keeping your teeth
good,
clean.
thank you. I would like to not have a root canal. Can you tell me how I can avoid one?
So root canal can happen by few reasons. One is if there is a big hole in your tooth and that eventually people ignore it. it and food keeps going in there. And then again, the tooth gets infected and the pain, the severe pain and swollen face, that is, then you have to get that tooth treated. So root canal treatment means that normally when you do a filling, you just fill the top of your tooth. But when you do a root canal, you have to fill all the way to the end of the roots. So it's a 2-part process. Some people do it in 1 part, but I prefer to do it in 2 parts, where I'll clean it out, put some medicine and leave it for all the bacteria to die and bring it back and then finish the treatment. The other reason you get a root canal is when there is too much of traumatic bite, which means you're biting very hard.
That was me.
And you're clenching, you're grinding your teeth at night, or you've had some injury. I've seen people having a motor vehicle accident and the jaw just gets hit from the bottom. And then the bang of that breaks your tooth, and then you end up having a root canal. So those are the reasons for root canal. But in this new age, this is something I'm seeing a lot, is where people are doing a lot of clenching and grinding, and their muscles have become very strong and so bad that they come in as a toothache. But it's not tooth, it's all that facial pain is causing them that, oh, it's my tooth that's hurting.
Well, that's interesting.
I have that
question, because masseters, is that called a masseters?
Yes.
Yeah. Sometimes I sit here and massage it too myself, and you'll feel that after the pressure releases in this area. It's usually from like stress or like clenching your teeth.
You would not believe, I see that so common. Every second patient. Back, like when I go back like 20 years ago, I haven't seen anybody. In the last 10 years, I started seeing people that were doing housekeeping, or if they were working nurse aid, or those people, they started giving, because, they're always bending, lifting, and they're clenching like that. And then after now, it's like every second person. It's just because the way we sit with the jaw face tilt down and we're looking at our phone, and the tip of the head gets heavier. Every angle you move forward, the head gets heavier and heavier. And that causes the teeth to sit in a position where you start in that clenching position and the jaw gets really, really strong. It's like building biceps. So now you build your master muscle.
Yeah, I've heard of that master muscle.
Question, and that's because it's interesting that you've seen that more increase. Would you say since the pandemic, you've seen more of an increase of this particular?
In general, I would say a pre-pandemic, I saw it too, but it's way more now. So when you look at pandemic, it's already 5 years. Whenever you say something, you say, oh, pre-COVID, and you go, wait a minute, it's already 5 years.
Yeah.
So, it's 2024 and we were in 2019 when that happened.
Is there a certain demographic that you're seeing is affected more, like younger generation or women or men compared to?
Mostly it's everyone. It's not like one or the other. The youngest person I saw the other day was 12 years old. Oh. And she goes, yeah, my dad is going to get so mad because I'm always on my iPad.
Wow.
And that family I've known them since her dad was a kid. So it's like second, third generation.
Yeah.
Right.
Dr. D, do things like mouth guard help? Do these types of, I guess, what do they call devices or things help?
They do help. But sometimes the pain is so bad that you have to get medicinal Botox in your jaw to relieve.
Oh, wow.
Yeah.
I was wondering why dentists offer Botox. I didn't understand that. I was like, are they getting into the cosmetic industry too? But that makes sense now. Yeah. Okay.
And what does the Botox do to the masseter muscles?
So the same thing what it does to other muscles is relaxes it. So it relaxes. So there are a lot of trigger points like in your masseter muscle, some in temporal region. And then when you inject it, it just relaxes the muscle, and then it's not in that constant clench position.
Wow. Dr. D, so much.
No, I'm learning so much today.
I would have never known this.
Thank you for coming on the podcast.
Yes.
This is why I always want our elders on here, because we
Yeah.
can learn so much from you. So thank you for that. I also, now pivoting a little bit, I want to ask you, Vic, through the course of your career, I'm sure you've had the opportunity to mentor students to come and do their practicum. How many students have you, give me a ballpark figure, have you mentored over the years through the course of your career?
I would say almost hundreds.
Wow.
I had a lot of immigrants, families, dentists that came. And then because when I came, I know how difficult it was.
Just pay for it.
Yes, it was very difficult. And whichever doctor will lend us a hand, we would run there, we would on Broadway and Granville, we'll go there. If it's in, wherever, whoever was helping, we took that help. So I always wanted to pay forward that.
Right.
And some of them, I still see them, and they're very appreciative of my help, and they always treat me as a peer.
That's really great.
Really
yeah,
fun.
I love that.
Dr. D, I want to add, this is a big deal I want to talk about here. In 2023, you won the Health Achievement Award at the Drishti Awards. This is a significant honor. When I heard about that, and I know you had sent me the information, I said, well done. I was so proud of you. What did that feel like for you when they, contacted you and notified you that you won and that you had to go and collect your award? What was that experience like for you?
It was like, I was so surprised because, it was a big honor, and getting chosen for that, it was a big surprise. It's very pleasantly, I'm the same person before the award and even now, but it was nice to get that recognition.
Yeah.
You know what, Dr. D, you know what I'm sensing here? That you don't like to toot your own horn.
Yeah.
Why am I getting
noticed
that here?
Yes.
Right? Because we on the podcast, sometimes you just gotta toot your own horn. Toot, toot! So we're gonna toot for you, but why is that? Because I can tell right now your body language just changed. But this is a huge honor, and you deserve
it.
Absolutely.
Thank you. I appreciate that.
You wrote an exam pregnant. That's a huge.
You endured sexism, racism, and you challenged the status quo going back 50 years ago to some women that would be some unimaginable to think that they even had the audacity and the capacity to go and do this. But you proved that. You were 9 months pregnant, and they're like, hell, I got business being here.
That was 7.5 months pregnant. Sorry.
Wow.
Oh my goodness. That's
last trimester. That's even harder.
This is what you call lessons in dentistry.
Yeah, this is called lessons in life. Yeah, that's amazing. Dr. D, when you look back at your career and, and to the evolution of dentistry, how it has changed so much, what have you learned about yourself through all of this? Because I know that there's no way you're retiring anytime soon, because if you do, you got to give me a heads up, because I got to find another dentist then. But I would just like to know, what have you learned?
Dentistry, you really have to work under pressure, and you have to be you'll be working in a kid's mouth and the kid is screaming, and you have to be so focused on this moving object and do it. It's like a lot of working under the pressure is to be more compassionate. You have to be more honest with patients. You have to be, you have to just be there, and when they're in pain, to listen to the patients.
Okay, let's pivot to you're being so modest here, Dr. D, and you're being so humble. I can tell that these personal questions are like, what? Yeah. You're talking about me? Why are you? And we want to know, because we want you to, of course, elevate and motivate the next generation of future female dentistry out there. Yeah. And you're going to hit a chord with somebody. Let's go. What was the best piece of life advice you ever received?
So that was, again, from my dad. When I graduated, my dad came to me and he said to me that when you go to work, you make sure you have service in mind. Always keep service in mind and treat your patients. And I think I remember that till today, that, that was a wonderful advice that I was given by him. Because my dad was also a very missionary person. He made millions of rupees in India. He was self-made millionaire, and then he went and he walked away from everything, and he did a lot of charity work. And I think he was somebody that walk the walk for me to follow.
Wow.
That's great.
That's
I love that.
Yeah, I love those kinds of stories because I think sometimes, especially in today's generation, everyone gets caught up and they think they know it all. And our parents are often 99.9% right most of the time
Yes.
with their life advice because they've already walked the walk, like you said. But we're so adamant, about challenging them all the time. But I love those full circle moments when it comes back to like it's all boils down to your roots, right? Mm-hmm. How your feet were planted and how your foundation was set for you. Mm-hmm. To me, it seems like you were set up for success right from the get go. You were told that you were a star and you could do anything your heart desired.
I also believe that it's your attitude. Like, how do you look at the world? Is the world is out there to get you or the world is out there to help you? So I always feel that the world is out there to help me. I see that woman who's sitting in the villages of Africa weaving this basket that someday is going to come on my table and I'll put bread in it. And I always look at the world as it's everybody's out there to help me.
That's a really great way. And I love what your dad said to teach you about service, because that's something that the three of us really are. The reason we're doing this podcast is that I think that's something that got lost in our generation of being in service. And I think that's probably why you've been doing this work for so long and continuing it, is because you have that service mindset. Mm-hmm. So kudos to your dad for saying that so long ago.
Yeah.
I
have a fun story that I want to share with Dr. D. And I think it just goes back to, the service that you were just mentioning right now, that customer service. So I know Dr. D since I was 15 years old and I'm in my 40s. And the reason I don't fully disclose my age, and not because I don't care about that, I will one day, is because I love to keep everybody guessing. But the reason is you were, of course, the first female South Asian dentist that was open at the time that had a clinic. I didn't know that at the time. Our parents naturally gravitated towards a South Asian dentist because we always want to help our own kind. Mm-hmm. So through the course of the years, and, I've moved geographically at different locations in the lower mainland. I, was your patient for 10, 15 years, left to another dentist's office just because of the locations and the time. But I always came back to you. And it was because Dr. D, you always made me feel like family. And that's what I've realized, that anyone that comes to your dental office, and if you go and look at the Google comments about you, they're high praises because you create that atmosphere. And a fun story I'll tell you is that one of the days that I came in and people were like, you went to the dentist on your birthday? This is a true story. I did go to the dentist, I think it was 2 years ago, to see Dr. D. I didn't tell them it was my birthday. I just booked it. I was like, I'm off this week. I'm going to get some cleaning done. And Dr. D found out it was my birthday. And she didn't have to do this. She went across the street to my famous baker. Shout out to you, Ravina. And you went and brought me some macarons. And then as I was leaving, she said, happy birthday to you.
Wow.
And that just hit my heart because you create that family atmosphere and that sense of community. And that, to me, I left, I was like, this is amazing. This is why I came back. And I was like, why did I ever leave you? And you always hug. Like, that's one thing I've realized is all of your technicians that are there, the dental hygienists, they seem like they have so much fun at your clinic. And what's the secret for that? Is it service?
Service mindset.
Yeah. And, a big shout out to my staff, of course. Mary has been with me for 32 years, as you know.
Wow.
I have Vipin, who's also been with me for over 12 years. Preeti is with us for 12 years. It's just like I always, from the beginning, I said this, that, we spend so much time here with each other that we have to have that kind of environment where, you want to be comfortable, because you go home to sleep and then you come back to work. So if you have the hostility or fights and all, then it does not make the work environment very pleasant. So I think I believe in that.
Well, it obviously works because if you've got people staying, I mean, today the landscape of people staying in companies is like 2 years and then they leave. So the fact that you've got 12 years, that speaks volumes.
Well, this is going to make me leave my dentist now. See what's going on over here. I gotta come check out this dentist over here.
He needs a new dentist too. Dr. D, so when you're not blowing out fires in people's mouths and doing root canals, what do you do in your spare time? Like, how do you juggle work life and balance?
So I have a lot of free time. I love gardening. So that's my other passion. So yeah, I love gardening. And
What do you
of course
garden?
have to-
What do you have in your garden?
What kind of vegetables are you growing?
Yeah.
So I've got a few going right now. I have some garlic, I have tomatoes, I have beans, I have carrots, I have all herbs,
Wow.
and I have some berries, goji berry, I have raspberry, I have strawberry, and I also have blackberry. So I've got a lot of this and that going on right now.
Wow, looks like I might be doing some backyard.
I know. It's gonna be a full harvest soon.
So come one day and all the like herbs and everything are gone.
You're welcome.
Thank you. Thank you. When you look back at your success and everything, what does it mean to you?
I don't think I ever look at it that way. So I'm just going along in life, and all this thing is happening. I'm just revealing, or it's unveiling to me as I'm going, I feel.
I want to go back to a fun fact that you said, and I don't know if you do this in your spare time, but you told me you know how to play the tabla. Let's talk about that.
That's awesome.
Yeah, what's up with that?
Again, my dad, he was passionate about all this. So he brought all these musical instruments for my brothers. My brothers got a teacher to teach them to play all these instruments, where my brothers were little vagabonds. And my dad was a president of a Gurdwara for 25 years. And back in the day, it was done as a seva. It was not like, okay, who's going to win the election? So then if somebody is doing prashad seva, then they will say, okay, 2 months, I'll do prashad seva. And if that person had to leave to go somewhere, then they'll say, okay, hey, I have to go out of town. Can you look after my seva? So that's how they did it. Mm-hmm. And then at that time, when we had a lot of classical singers that would come and they would perform, and that's how I got my interest in all the classical music. Wow. And it was always because Gurbani is all written in classical the format. Yeah. Mm-hmm. So they would do the kirtan in that classical format. And one time, their name was Taram Singh Jakhmi, and they were top Ragi Jata. Mm-hmm. And their son was doing tabla, and he was just like a young person. He was like early 20s. And when he came out, everybody, oh, shabash, you did so good. And they were giving him all put-ups. But then I, as a kid, went to him and I said, oh, Bali Baji, you did so good. And he looks at me and he goes, what do you know? You don't even know how to play tabla. Oh. And I go, okay, I am going to learn how to play tabla. So then I went to my mom, and summer holidays, had to do something. So I said to my mom, can you hire me a tabla teacher? I want to learn how to play tabla. So then I remembered playing tabla in my summer holidays all the time. I could see all my neighbors' kids playing outside, and I'm doing my tabla practice. So, that was my story.
You're determined.
Yeah, definitely determined.
You know what, Dr. D? I thought I knew you, but I really got to know you. There's a little firecracker. You're a little pataki, aren't you? When someone says you can't do this, you're like, I'll show you.
Yeah, that was quite a. I was very happy. And then they did an exam for me one time, I remember. Then my mom sort of said, okay, enough of playing tabla. Teach her how to play harmonium now. I want her to learn singing. So I started singing. And then, so they came one day, and then they found out that I am learning how to sing. So I remember I did a rag called Malkons, and I was singing. And then again, Bali Paji, the person who was a good tabla player, he sat with me and he was playing tabla. And he just, with tabla, you give the beat, but then you can give this confusing beat as long the person has to stay on their whatever the thing. Like your beat. And he was confusing me, but I just was so stressed. I stayed on my thing, and then they were very happy that I didn't lose. So,
So he was testing you, I think.
Yeah,
he was
clearly.
Testing you, right?
Yeah, so at the end, I got to play with him, and I was happy about that.
Okay, so if this was a tabla here, do you think you can do some beats or like drop a lot, like a singing? Like, because you said you could sing.
I'm not going to sing, but I can.
Could you do a little like doogie or something?
Yeah, I can do it. This is 4 beats.
Oh, okay.
That's 4 beats.
And then this is 16 beats. Like,
wow.
Oh, neat. Thank you.
That's
of course,
amazing.
it makes a different sound on
Right.
the tabla
Yeah.
compared to. But once you start playing tabla, what happens when you're growing, when you're hanging out or do whatever, you always, like now I'm a little bit out of it, but you'll find your clavicle and you play on it. I caught myself playing on my clavicle bone. You always are like playing like this on your, it's
Interesting.
So many people do that. Like
It's automatic.
It's just automatic. Even my son learned how to play tabla, and he'll be sitting there and his hand will be going. It's but natural. It's just kind of in you.
That's like dad, because dad
Yeah,
can play the
Dad's
tabla
always
and he'd
playing
always
something,
like always
doing that.
playing a beat.
Yeah.
It's just part of
Part of your DNA, right? And now, Dr. D, I've got 2 questions that I want to ask you, and then we're going to start wrapping it up here. To any of our young listeners, female audience, and not that I'm discriminating against men, but I definitely want to see the younger female generation succeed. What is your advice to them if they do want to pursue dentistry? What would you say to them?
Dentistry is a good career. If they have passion for it, just go ahead and do it. And also, people like we have small hands to work in their mouth, so that's another incentive. But yeah, it's. I think it's a good career.
Just to go do it, right?
Just
go
do it.
pursue it. Okay, now, Dr. D, in closing here, we are big advocates of promoting inner child. We talk about our inner child because we feel that it doesn't matter what we do through life and how you evolve, that inner child in you, it's always there. It's always longing to be loved, appreciated, included, and accepted. And the question that I have for you in closing is, if the young Dr. D and you were to look back at your reflection in the mirror today and that little girl looked at you, what would she say to you today?
I think my little self will say to me, "You did it."
She'd be proud of you.
She'll be proud of me, definitely.
Yeah.
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 It's great.
Anything
Stayed
else?
course.
Yeah.
I stayed course.
You stayed course.
You
And then
didn't,
she
you didn't
also-
give up, especially with facing all that adversity
Good for
for
you.
the time.
She'd be proud of you.
Yes. Even like this is something on the side. When we did open our Rainbow Dental Clinic, I was looking for a spot. And then while we were looking, I got pregnant and we found a spot. Now I'm like pregnant and moved into a new spot. And I think I worked on my day of my due date. I was working on a patient.
Wow.
And because patient followed me to that office. And I still remember the lady, her head was here, I was working. And she goes, "Oh my God, your baby just kicked me." And then I said, I think I should take a few days off, And then after maternity, I had C-section and I had only 13 days off. And
Whoa.
it is hard work. I'm not going to lie. It is hard work. And that time it was harder because my daughter was older. So I would drop her in kindergarten or play school, whatever, preschool, pick her up at 11:30, then start my shift from 12 to 8. That was my shift early on in my career.
Wow.
And then, slowly you build. So hard work is always there.
Yeah.
You have to work hard to go forward.
Okay, I lied. One final question, because there's just so much wisdom here, Dr. D. I want to know your thoughts on these 2 words and what they mean. What is resiliency and determination? What do those 2 words mean to you?
They're very important.
Yeah.
They're very important.
Wise words. They're very important. So with that said, we have Dr. Inderjit Dadiala, aka Dr. D, in the house today talking to us about oral health, life, and everything in between. And it was a pleasure having you on.
Yes, thank you.
Thank you so much.
Yes.
You taught us so much and just gracing us with your presence. I thank you for taking time out of your busy schedule. I know you could be doing root canals today, but you came to be in conversation with the tribe. So we thank you for that.
It was my pleasure.
Thank you. And keep doing the amazing work that you're doing. You are a true inspiration in our community. Huge honor to have you here. And we love you. I always want to squeeze my guts. And thank you for just gracing us with all of your knowledge.
Thank you.
And all the lessons that especially your dad and your mom taught you.
Yeah, and in one person, you've elevated, motivated, and inspired us. All three words from coming from one person.
Yeah,
because your story is very profound, and you're a trailblazer for your time.
You really are, and you spoke your truth. So thank you.
Yeah, thank you for coming on.
Being there for women and just standing up in your conviction, because to me, it seems throughout the course of your career, you're always challenged. And for some reason, I get this thing where you're always seem to be pregnant and moving around or something.
Yeah.
There's a theme happening here.
Yeah.
And you never gave up. And I love that.
Yes, we can do it. We have more power than you would believe.
I love
Women
that.
have lots of power.
Oh, yeah.
Thank you, Dr. D. True inspiration. So with that said, this was part 2 of our conversation with the amazing Dr. Inderjit Dadiala, dentist and owner of Rainbow Dental Center. Please check her out on Instagram. We'll put her information here. And if you're living in the Lower Mainland and you're looking for a badass dentist that perhaps might give you a treat on your birthday, I am going to highly recommend the staff at Rainbow Dental Center, because it really is community and it's all about family, and that's what we stand for. So we're going to be signing off. The tribe is going to be back next week. Don't forget to hit that subscribe button. Go and check out Dr. D at Rainbow Dental Center on IG as well, and pay her a visit. And until next week, friends and family, thank you for allowing us into your home and your heart. We appreciate your ongoing support. The team is going to be back next week. Bye for now.
Bye-bye.
See ya.